In this film, you will learn, step by step, how to empty your bladder. It is relatively simple, but will require some practice. Start by washing your hands thoroughly with water and soap. Remember also to wash your thumbs. Alcohol hand gel can be used if you don't have access to washing facilities. Make sure you have all the equipment you will need before you start. You will need a catheter set, intimate wipes or soap with neutral pH value and water to clean your penis. A drape and a pantler may also be useful. Pull your clothes down so you have free access when doing the catheterization. You may use a pantler holding your clothes in place. To avoid wetting your clothes, you may place a drape under your penis. To prevent pushing bacteria into the urethra and bladder when you use the catheter, you must clean the head of your penis properly. Gently pull the foreskin back and wash the head of the penis. To remove any bacteria that might be present at the opening of the urethra, you should wash in a circular motion, starting at the urethra and working outward. Use each wipe only once. Twist to open the tube and remove the lid. Unfold the bag. Twist and pull the catheter out of the tubing. Now it is ready to insert. Make sure that the catheter does not touch anything before you enter it into the urethra. If it does so, you must use a new catheter. Touching the sink or your clothes or skin, for example, will contaminate the catheter and can potentially cause infection. Hold your penis pointing upwards and close to your stomach. This will ease the insertion of the catheter as the natural S shape of the urethra is changed into a U shape. Provide a gentle pressure to the head of your penis in order to open up the urethra, but be careful not to squeeze your penis as this may obstruct the passage of the catheter during insertion into the urethra. To help insertion of the catheter, it is important that you relax. Slowly and gently insert the catheter into your urethra. You may feel some resistance when the catheter is passing the prostate and the sphincter, so be gentle. Continue to insert the catheter until it reaches your bladder and the urine starts to flow. Then continue for a few centimeters further. When the flow stops, move a little and straighten yourself up to make sure that the bladder is completely empty. Withdraw the catheter slowly to ensure that you drain any remaining urine at the base of your bladder. With some force, push the catheter back into the tubing and reseal it by turning the catheter clockwise. Open the urine bag by tearing off the tab and empty it into the toilet. You can dispose of your catheter set in your household rubbish. Do not flush it down the toilet. Wash your hands and you have completed the process. The catheterization procedure must always be carried out under guidance from a healthcare professional. The instructions provided in this film is only intended as follow-up to the advice you have already been